There'll be big improvements for patient safety and staff safety, for efficiency of how we work, and for privacy for our patients, because this is long overdue. I can't even describe how great it's going to be for everybody.
The old space is primarily, if not exclusively, divided by curtains, so more treatment bays. I believe there are some dedicated individual spaces. The new ED will all be private rooms with sliding glass doors that will break away for different types of equipment and stretcher sizes coming in. But patients will have, and families will have, greatly improved privacy.
The existing department is essentially a single hallway design with treatment rooms off either side of that hallway. And the new expanded department will have 2 hallways, treatment rooms off either side. The staff areas, the team station, the charge and unit secretary desks.
The benefits are endless. It looks like the nursing station will be more centralized than we are now, so we'll be able to have a view of all of the rooms just sitting there getting our charting done when we're not actually at the bedside.
There's a nice workstation in the middle. We don't call it a nurse's station in our department, we call it the hub, because the nurses and the docs and the mid-level providers all work elbow to elbow in the same area. We'll have a dedicated medication room. We have never had one of those in the emergency department, which definitely leads to patient safety, a quiet area while you're preparing your meds. Our utility rooms, much better. We'll have our resuscitation room will be all renovated, as well as our trauma room will be all renovated. Our ambulance bay, new ambulance doors, a floor refinish there. Our registration area is going to be so much improved because they're actually going to be inside the ED and part of our locked system.
The capacity to treat, it gets addressed in a number of different ways. The additional space is really important. It also gives staff the room to do what they need to do, whether it's get materials, get a large number of people around a patient in the trauma room, for instance. It also gives the families and the physicians some privacy to have discussions as needed.
And your support rooms, such as nourishment, medication, and your supply rooms, will be centrally located and accessible from both hallways. So increase your efficiency in your workflows.
Right now, I think we've got 5 closed door rooms and we've got a lot of curtain rooms. And from the pictures I've seen, it looks like most rooms will have a closed door, which is great. Right now, an emergency department's not a quiet place. So being able to close a door for a patient that wants a quiet room is great. There'll be a lot more space.
There'll be private rooms. Every patient will have a private room. They're not huge rooms, but there's enough room for your visitor. They'll have sliding glass doors, most of them, which will help with sound.
As well as I've heard there's going to be a computer in every room, which we don't have that luxury right now. So we can actually sit at the bedside and get charting done with the patient next to us and not have to remember what we're going to type in the computer when we get back to our desk. Right now we look at our medications and before we go into a room and we double check that and verify everything. But now we'll actually be able to have the chart open, looking at what medications we're administering. If there's any questions, we can pull up databases to make sure the medications we're giving are being given safely.
So there'll be more efficient workflows. The providers' spaces will be improved, even down to things like material management spaces where the stuff that you need to get to treat the patient is organized better and more readily available.
The current ED usable space is approximately 9,700 square feet. I believe it has 14 treatment spaces, and the future one will add 2,400 plus or minus new space, and the treatment spaces will increase to 21 total, 17 of which are standard treatment room, trauma, and cardiac space, and 4 of which are part of a mental health suite.
The space that's being developed for mental health care it was one of the drivers for this renovation, actually, because over the years, mental health needs have increased, unfortunately, in the community. And the space that we're currently in is not particularly well designed to care for patients, multiple patients with mental health needs.
It's not the most therapeutic space. It's hard to get in and out of. It doesn't feel relaxing or calming. I think having a more calming therapeutic space for mental health patients will be great.
There's 4 rooms and a team station that are dedicated to this service and this need, which is fairly acute in the community and in the state of Vermont.
We have a big need at times for those rooms in our community, and we know they're temporary holding areas until they can get to where they need to be for treatment. But these will be much better than what we have in place now.
Having that dedicated space that will provide easy access to staff while at the same time the privacy and the calmer setting from being in the thick of an operating ED is a nice improvement. And there's a number of behavioral health specific elements embedded in the design. So we're really excited and happy about that step forward.
There's just so many things that will be improved that our patients in this community deserve and have been waiting for so long, and have been dealing with bad circumstances, poor circumstances for the last couple of years. So it's just so needed.